Chinese health authorities are still working to identify the virus behind a pneumonia outbreak in the central city of Wuhan.
I have today declared that the coronavirus presents a public health emergency in the United States.
It has been confirmed that there are 2 cases now in England.
COVID-19 can be characterized as a pandemic.
As a team from Australia and the US, we've come together to explore life in a post-pandemic world. To do this, we've established an organisation, REACH, where we aim to spread awareness on the gender and race issues that came to light due to the pandemic, and address the solutions to these concerns. Our organisation's website features blog posts, personal stories, a resource guide, petitions, artwork, and many other functions. We hope you join us on our website and on social media to help navigate this post-pandemic world. COVID-19 saw the devastation of global health, but a disproportionate amount of racial minorities and women have been faced with additional struggles within the COVID-19 pandemic, struggles which are still exacerbated in this post-pandemic world. So first, let's talk about racial minorities, how they were vilified, mistreated, and ignored during the pandemic, and still today.
Hate has and always will be present. Tensions grew higher as President Trump labeled the virus Kung Flu and the China virus. All Asian Americans became a scapegoat for the coronavirus. Hate crimes against Asian citizens saw an increase of 77% and rose to more than 9,000 incidents in 2021. Hate spread through America due to the fear people had against Asians. As a student, athlete, and musician, the impact of my identity differs between each setting. In the classroom, students would derisively joke, blaming me specifically for bringing the virus into the country. Regardless of ethnicity, all Asians were viewed as a problem. Out on the field, it wasn't any better. While playing an indoor lacrosse league, teams would blatantly chant, "Stop the spread," and slurs as I was the only Asian on the field. The conservatory, which carried the majority of the Asian population in my school, seemed to be a haven in my school, safe from the threats and comments. However, due to this fact, the music program had received hate.
Black and Hispanic New Yorkers continue to die of COVID-19 twice as often as white New Yorkers. Healthcare bias based on race has limited the quality of treatment non-white patients receive, with half of white medical trainees believing that black skin is thicker than white and that black people have less sensitive nerve endings than white people, leading them to be undertreated for pain. Additionally, many doctors perceive black people's requests for help to be drug-seeking behavior, or that they are simply overly passionate and hysterical. Black and Hispanic Americans are less likely to be able to afford health insurance. 55.5% of African Americans had private health insurance, compared to the 75.4% of white Americans. Overall, Black Americans have higher rates of unemployment and underrepresentation in good-paying jobs that include health insurance as part of the benefit package. People of color are also often at greater risk for the virus, as they are more likely to live in crowded conditions, to work in service jobs that put them in close proximity to others, to have to go to work because they can't afford to miss it, to take public transportation, and to lack access to protective gear at work. Further, a lot of US COVID hotlines only offer services in English, making it hard for minorities to access reliable health information. Universal healthcare could be a solution, but it needs to be able to reach all citizens for it to truly combat medical inequality. In Australia, despite universal healthcare, rural and Indigenous communities aren't given the same level of medical accessibility. So how can we go about solving this? There needs to be better medical diversity training for healthcare, so sign the petition on our website that enables that. But on an individual level, we can be aware of our medical rights. Australia has posters in every room of hospitals and doctors' rooms outlining your medical rights. The US can certainly adopt these measures to ensure everyone is aware of their healthcare rights. Additionally, the COVID-19 pandemic impacted women's rights in many regards, especially concerning domestic violence, access to adequate healthcare, and reproductive rights. During the pandemic, global rates of domestic violence grew exponentially. In Australia, pre-pandemic, 1 woman a week was killed by their partner. But since then, domestic violence has only gotten worse. The statistics have been alarming. In Spain, the emergency number for domestic violence received 18% more calls in the first 2 weeks of lockdown. In the US, there was a 30% increase in aggravated domestic assaults in New York, a 27% increase in Boston, and a 16% increase in Seattle. In France, reports have increased by 30%, and Singapore's helplines have had a 33% increase in calls. But how can we solve this? Other than spreading awareness, governments need to expand helplines, fund shelters, and other safe accommodation options for survivors. As quarantine has limited personal mobility, it's important we also come up with solutions that can access people stuck at home. Italy and the UK have released or improved concealed apps through which women can seek services to avoid calling in close quarters with abusers. Some countries are tackling the causes of the violence as well. Greenland has banned alcohol sales in its capital to limit the risk of home violence, as alcohol abuse has been linked to more severe violent episodes. Curtailing gun sales and limiting access to fatal weapons would certainly reduce the risk of domestic homicides. Modifications to family law and justice systems can also be a feasible solution. To allow the justice system to better respond to cases during quarantine, Australia has allowed courts to impose electronic monitoring requirements for bail and conditionally suspend imprisonment orders. They also enabled the online filing of restraining orders, created new offences, increased fines, and extended limitation periods for restraining orders. But it's not just domestic violence. Women have also been impacted by the pandemic through the lack of accessible abortions. Marie Stopes Australia, a large provider of family planning and abortion, reported demand for this service had gone up 25% during the pandemic. Across the world, lockdowns led to women being unable to visit abortion clinics. Abortions were already an expensive procedure, and the financial stress that came with COVID limited its accessibility. Even in countries like Australia, where the government covers 50% of abortion costs, this was a problem. Further, COVID saw resource shortages due to the suppliers cancelling orders of PPE to abortion clinics on the basis that these supplies were reserved for health professionals. But for many, abortion is an essential, life-saving and non-elective procedure. How can we solve this in the context of COVID? Early medical abortion can be delivered via telehealth, options that the UK and Ireland have quickly adopted during the pandemic. In the wake of the overturning of Roe v. Wade, it's particularly important to acknowledge that banning abortions is even more dangerous, especially after the inaccessibility during the pandemic. Especially given the 20% increase in rapes and sexual violence due to the pandemic, women's reproductive rights have never been more important. It is also important that we provide more widespread access to the healthcare essentials like rape kits, whose production went down during the pandemic. Clearly, there have been some differences in how Western democracies handled the pandemic, but unfortunately, an underlying theme present in all of them seems to perpetuate disadvantages for both women and minority races. More needs to be done, and we can start by sharing this video, sharing this message, and sparking the discussions needed to tackle inequality. Because when we reach out, this post-pandemic world gets just a bit more bearable.